What you saw previously, I think, is the logic is slightly wrong, because power is supposed to be the probability of observing a significant result in the study based on some assumptions about your sample size, and in this kind of example, based on assumptions about the response rates in the two groups. So you postulate something when you're designing the study. We're going to have a certain number of patients, and we expect the response rate under the psychiatrist to be such and such, and under the community health workers we expect it to be this value. We calculate what the power is, and we obviously like to run a study where the power is high enough so that we'll actually demonstrate a significant result if what we assume about the response rates is true. So, just to repeat, power is the probability of observing a significant result under those assumptions. Right. This study has already been done, and the result is non-significant. I therefore don't need a power calculation to tell me if it's going to be significant or not, because I already know it is non-significant with probability 1. Okay? So, let's just back up a little bit and think about why you're trying to do this kind of thing. The reason that you asked the question about power at all is you did this study in good faith, and it turns out, seems nothing much is going on. Doesn't seem that way in terms of the p-value, but notice that in my view, 40 versus 62% is actually quite an interesting difference. Right? It's not that nothing's happening, it's just that the study failed to show it. So it raises the question of the study power. And you want to know if the reason for the non-significance here is because of lack of power. Okay? But I think it's more sensible to do that in terms of the original specifications. So you would like to know what the power was. In other words, look it up if it's recorded in the protocol. Just look it up. Look what that power was. But don't do it in this way on a post hoc basis. And in fact, several journals have published very prominently advisories to not do post hoc power calculations. And in the break, somebody, who was it? Somebody told me, was it you, David? Yeah, Dr. Tambu told me that they had a paper where the referee had asked for a power calculation in a study that was non-significant. The editor overruled that and said, we don't do that. We don't do that because of the illogicality of it. So, if you do what we did with that program at all in that way, just think about what it would mean. You're asking about the probability of a significant result in a study with this many patients, however many it is, 35 under community health and 35 exactly under psychiatry, and we're going to suppose that the response rates are 40 and 62.8%. That doesn't sound very sensible, does it? And the only way that you could possibly make sense of it would be that would be the power for another study in the future with exactly those response rates and those sample sizes. So if you were actually going to do that with that assumption, well, okay, then that's the power. But that's a pretty contorted way to think of it, right? And imagine what will happen if the difference is very small. The power will go to essentially nothing, even though under reasonable assumptions, there probably is some moderate power at any rate. And, it's just slightly illogical. So I would strongly advise you not to use power in that kind of way, but it's fine to use power calculations at the beginning when you have a reasonable set of working assumptions for your target sample size and response rates. One other issue that came up in discussion in the break is how often, and this happens, whoops, I'm sorry, I'm hitting things by mistake. I'm sure you've run into this situation either as a consulting statistician or as a clinician. You don't ask that question about power. You say, well, we're going to have 50 patients next year. What can I do with that? Right? That's the kind of fixture that you have to work around. And so sometimes people will do these power calculations, manipulating them so that it looks sensible with the available number of patients. So you can, if you like, contrive a power calculation so that it works out that the target sample size, just very conveniently happens to be the number that you will have available. That's a little bit of a cynical view, and I can see it from the other perspective, that often you do have a fixed number, and then it doesn't really make sense directly to talk about power. You certainly can calculate the power and see whether it's close to what you would like to observe, and maybe it'll turn out fine, that with your 50 patients, for the effect size you're thinking about and with the outcome that you're looking at, your power is going to be quite reasonable. So it may work out. If not, well, at least you can say what the precision is going to be at the end of the day and what the power might be. So you can say something. If it's disastrous, you've got 50 patients and your power's pathetic, I think you might want to rethink it and change the question. Either a different outcome or different observations for your 50 patients, or just take another clinical specialty and start again. Okay, I don't know if anybody wants to comment on what I just said. Yes? Some conditions under which the power can be lower than? Oh, okay, so you're saying you might have a situation where the power is 50%? Okay, you know what? I'll have a coin in my pocket. I'll save you the trouble of doing the study. I'll just toss the coin and I'll tell you if the result's significant or not. I'll save you a lot of money and time. That's the argument against it, of course. But again, this whole thing about power is very much tied up with p-values, and the p-value is not really a very good measure of evidence. So it's still quite reasonable to think about a study that is small-ish and doesn't have a lot of power, but you're still interested to get the best possible estimator of the treatment effect with an associated confidence interval telling you about precision. So a good example of that would be, well, let's suppose it's a very rare cancer. There simply aren't, 500 patients that you would like with the ideal statistical study, but you do want to say something about the available patients and what the treatment effect might be. Yeah.
For this study itself, I would all like to see it from another point of view, define this is not statistically significant. But this would be the right example also where we feel clinically it is significant, because 20% psychiatric illness is not very easy to treat. So even whatever amount of benefit I develop for the patient, so I think this is the right example where everything which is statistically insignificant will not be clinically significant. This does visit that. Interpretation should be guarded that yes, it has great clinical significance, even if it is not significant.
Right, so you're saying that you believe that, as I did, that 40 versus 62% is actually quite a meaningful result. Yes, absolutely. Yeah.
After the trial is over, so probably any statistical test or anything
Well,
like that.
okay, it may not be that something actually went wrong, but this is just what turned out. This is what nature is telling us about this particular intervention. Nothing went wrong, and this is just the result. But one thing that could have gone slightly wrong with your approach to the problem is that you could have got it wrong about the response rates with a binary outcome like this, and that's a very common situation. So let's say you design a study and mortality is your outcome, and you're expecting, after a year, let's say you're expecting 30% of your patients to have died, but it turned out, unfortunately, not enough of them died. They were very inconsiderate towards you, and sorry, that was a joke, and a much smaller percentage of mortality was observed. That, of course, would translate to lower power, right? If the response rate to the intervention was lower and you had less events, in this case death, than you had planned for. So that would, in a sense, be something that went wrong in the context of not assessing the assumptions at the beginning quite correctly. Now, there are going to be some presentations on adaptive designs, and one of the things that you can do is monitor the interim data as you go along, and if you find out that the event rate is in fact lower than you had planned, you can actually modify the design, for instance, by increasing the sample size to compensate. And sometimes that can even work the other way. You may find out well, there are actually more events than we had planned for, which is great news. More people are dying, that's great. We can stop the study earlier with good power. Right? So that's one response to avoid this difficulty that we plan something, we have to wait till the end, and then we find out a result like that.